When women are diagnosed with breast cancer and they're considering surgical options, a lot of them just naturally think, if I'm going to remove one breast, why not the other? Like, that's the first natural thought that comes to mind. It's really important for them to understand that a mastectomy alone is hard to get through, but removing both is a little more complicated. I'm Crystal Chu, and I'm a PhD student at the School of Nursing here at UVA. I've been an oncology nurse for almost 10 years and was working mostly with patients diagnosed with breast cancer. Hearing them have those, if I had known this or if I had thought about that maybe things would have been different for them. Just digging deeper to say, what can we do to make sure that they're making the best choices through their care and ensuring that when they enter survivorship, that they have the best quality of life possible.
So a contralateral prophylactic mastectomy is when a patient comes in with a diagnosis of breast cancer in one breast and is considering having the opposite side removed for prevention of future cancers. When a woman needs breast surgery for a primary breast cancer, adding a contralateral or an opposite side procedure increases the risk. It just increases the time in the operating room, it increases the rate of infection, bleeding, all the complications that we see with the primary surgery, we're then seeing, almost twice as many because you're doing both sides.
My research really focuses on that decision point and creating this decision aid to make sure that they have the clinical background that they need to understand and really bringing forth their own values and goals. First part goes into clinical background. I make sure to just emphasize what they've already heard from the clinical team. Pros and cons of this procedure, risk involved, potential complications. And then we go into, what are your goals? What's influencing you? The second balance sheet talks about benefits to them and consideration of others. We rarely make a decision on our own. Is someone else afraid that I'm going to have a cancer again? Is my partner worried about what I'm going to look like later? Once they've gone through the whole exercise, say what their preference is.
Many times there is a choice for the patient to make, and it's not always crystal clear which side they should end up on. And so the decision aids really add a way for this to be more formalized, more thorough, and for the patient, I think, to drive more of the conversation. It gives them time to go away from me and take time with Crystal or another wonderful nurse to think through this, and then come back to me with more understanding and probably in a better place to make the best decision for them.
When they have the decision aid to really make their points clear and bring that back to the surgeon, it's a more productive conversation, and it doesn't feel like they're arguing. It feels like they can articulate their needs and goals in a way that the surgeon can hear and understand. And this just gave them their voice to say, this is what I want and why. Going through this doesn't necessarily change their mind, but it makes them feel more solid, more confident in that choice. And to me, that's really the goal. I want people to feel like they're making a choice and that they're not going to look back and regret it. That that these are potential complications, and even if those occur, I'm still okay with my choice.